All the old obstacles to holding us back from telehealth integration are still there. Provider buy-in, rules and regulations, inconsistent payment policies, slower to develop protocols for certain conditions and things like that. But for the most part, a lot of that has been accelerated and worked out a lot. I think the biggest thing that health systems need to worry about that need to get out in front of, I should say, in order to make sure that this level of access and this innovative care continues, is really making sure it fits into the structure of the health system, and unfortunately I largely mean financial. If you imagine that just a few years ago, almost all care happened in person, you had a certain number of buildings, you had your staff working in a clinic. Now, you don't need as much building, and perhaps your staff should be working from home or somehow virtually supporting things. And you don't necessarily need a front desk, but you need a way to get a consent form and all these other things. And so we're kind of structured wrong. Even if you're doing 20% or 15% of your care via virtual, that doesn't sound a lot, but that's a big chunk of expense that a health system might be losing out on. And it's just a pivot point, perhaps, depending on what you choose. But if you decide that there's too much of a risk and you want to make sure you bring all the patients in and they come to you and you get all your studies and everything done, and you don't miss anything because you're so nervous about keeping your doors open or whatever, then you miss the opportunity to sort of become nimble or become more flexible and to change your infrastructure. I would say the biggest barrier really is the intent of the health systems and how this new type of care that's happening at scale, not new, but new at scale, fits. And if it fits, if we can make it fit, if it can lower the overall cost of care and be beneficial to everyone, it'll stick in the long run. If we can't make it fit, even our best intentions will sort of be lost to the unfortunate hard-blowing winds of financial needs of keeping your doors open.
We've learned a lot from the pandemic. There's been a lot of negative experiences, but one of the positives, we've realized that there's even a broader range of health-related services that can be provided via telehealth. Obstetricians and other prenatal care providers have been able to provide some level of prenatal care and post-pregnancy care to pregnant women when they're not able to come in, either because of the height of the pandemic not putting them at risk for exposure, or because of even other problems as far as getting into the care setting. And so there are areas like that and other types of services we've realized that we can provide very effectively through telehealth. Fortunately, during that time also, but both the federal and state level, we've seen expanded coverage and reimbursement for those. And so it's going to be critically important that we don't take a step backwards and we make sure that those services that can be effectively done via telehealth, diagnostic services, treatment services, counseling and therapy services, don't go away. And all of a sudden we have people who finally were able to get access to those kinds of care and services not have it again.